I want to start first by reminding everyone why we're talking about masks in the first place. And that's because COVID-19 spreads primarily through the air by small virus-containing particles that float and move from person to person at close range, primarily, but at times over longer distances, like cigarette smoke or perfume can move through a room when it's not well ventilated. And that well-made, well-fitting face masks provide meaningful protection against infection, and that the benefit increases with increasing community mask use. The risk of COVID-19 spread is increased in crowded indoor spaces with unvaccinated people, and especially with poor ventilation and activities that can increase the amount of virus in the air, such as loud talking, singing, shouting, and aerobic exercise. Now, last week, CDC Director Walensky unexpectedly announced new guidance that people vaccinated for COVID-19 no longer need to wear face masks for most activities indoors or out, while unvaccinated people should continue to do so, especially indoors. That guidance is based on the fact that vaccines work incredibly well and vaccinated people have a very high level of protection against COVID-19 compared to unvaccinated, and a much lower chance of getting sick or spreading COVID-19 to others. There's no debate about that fact. So why are we not immediately adopting this guidance, and why are we diverging from CDC and Department of Health? There's several reasons, and I'm going to go through the rationale with you. First and foremost, because there's no practical way to know who is vaccinated and who is not in public spaces, placing a burden on businesses and frontline workers, and undermining the effectiveness of the guidance wherever COVID-19 is still circulating and vaccination rates are not high. So this policy would result in unvaccinated and vaccinated people without masks in close contact in indoor settings at a time when we have substantial COVID-19 activity in the community, raising the risk for the spread of COVID-19. There's no need to do anything at this time that could increase COVID-19 transmission in our community, especially given indoor masking has been in place for over a year and working very well. When unvaccinated people are not wearing masks indoors, they are at risk both of getting COVID-19 themselves, as well as spreading it to other people, primarily those who are unvaccinated. And remember that people spread COVID-19 before they have symptoms or know that they are ill. They look well, they feel well, yet they're breathing that virus that floats into the air. In addition, many frontline workers would have prolonged contact indoors with maskless people. And vaccination coverage rates are relatively low at this time in teens and in young and middle-aged adults, many of whom work in frontline public-facing businesses and workplaces. There are also unvaccinated children in many indoor public settings, and children between 12 and 15 years of age have not had much time to become vaccinated yet. Now, COVID-19 occurs primarily among unvaccinated people, but because no vaccine is 100% effective, infections can also occur, rarely, among vaccinated people, even though their relative protection remains high, and most infections among the vaccinated will be mild or even asymptomatic. However, there are tens of thousands of people in King County who have some form of immunosuppression from an organ transplant, a bone marrow transplant, or other diseases that require medications that suppress the immune system. Many of these people remain vulnerable even though they've been vaccinated. And coincidentally, a recent publication from the CDC itself concluded that high vaccination coverage and compliance with masking and other COVID-19 prevention strategies are essential to control COVID-19 and prevent surges in hospitalizations and deaths in the coming months. Now, CDC Director Walensky subsequently clarified her remarks that ending indoor mask mandates should be linked to local COVID-19 disease and vaccination coverage, so the local situation. So let's look at our local situation. In King County, COVID-19 vaccine coverage rates and COVID-19 risk vary by age, race, ethnicity, and geography, which raises equity concerns. We have just recently turned the corner on a fourth wave of infections, and hospitalizations and case rates are currently at a substantial level of COVID-19 transmission. With the highest rates in unvaccinated middle-aged adults and teens in South and Southeast King County and among Native Hawaiian, Pacific Islanders, Hispanic, Black, and Native American, Alaskan Native communities. Current case numbers are higher than they were before the fourth wave began and higher than they were at last summer's peak. So again, we've just recently turned the corner on that fourth wave of infections and hospitalizations. We currently have substantial to high levels of COVID-19 transmission continuing. Now, although some would say our vaccination rates are relatively high overall, with 70% of eligible people having received one or more doses and 55% having completed the series, these rates are not seen equally throughout the population because the majority of those fully vaccinated are older adults, and many younger people remain unvaccinated. For example, only 57% of people between 12 and 40 years of age have received one dose, and only 40% have completed the series. And the completion rates are 16% in 12 to 19-year-olds, 42% in 20 to 29-year-olds, 50% in 30 to 39-year-olds, and 38% among Black and 36% among Hispanic community members. That's compared to 54% for whites. Vaccination rates are also lower in neighborhoods in South and Southeast King County compared with Seattle, North King County, and the East Side. So the CDC's scientific rationale is rock solid with respect to the high degree of protection for vaccinated people. Ending the indoor mask mandate at this time in King County, however, would increase the risk for COVID-19 spread in public spaces and workplaces, primarily among the unvaccinated, including people who would like to be vaccinated but have not yet done so, those not eligible for vaccine currently, and those who do not respond to the vaccine. For these reasons, I believe that before ending the indoor mask mandate, it is clearly in the best interests of the people of King County to continue doing what has been working for us for over a year, for just a bit longer, to allow more people to be vaccinated and for our COVID-19 rates to drop to safer levels, which will bring greater community protection to all of us. So today I'm issuing a health officer directive that replaces the previous directive on mask wearing that was issued in 2020. And this directive includes that everyone 5 years of age and older in King County should continue to wear a face covering within all indoor public spaces unless a state-approved method is used to assure that people allowed inside have been fully vaccinated. Let me repeat that. Everyone 5 years of age and older in King County should continue wearing a face covering within indoor public spaces unless a state-approved method is used to assure that all people allowed inside have been fully vaccinated. Now, someone is considered fully vaccinated 2 weeks after their second shot, or in the case of the Johnson & Johnson vaccine, 2 weeks after their first shot. And everyone in the setting of correctional facilities, homeless shelters, long-term care facilities, schools, public transportation, other healthcare settings must also wear a well-fitted and well-made face mask and adhere to workplace guidance from the Washington State Department of Health. Now, this directive applies to indoor spaces that are open to the public, such as retail, grocery stores, restaurants, government buildings, and other places of employment where members of the public can enter freely. It does not apply to indoor non-public spaces, such as businesses, offices, and other places of employment with limited access. Employers should continue to follow current guidance and requirements from the Washington State Department of Labor and Industries on worker safety in those settings. This directive also does not apply to outdoor places. Please follow current Washington State guidance and directives on the use of masks outdoors. I strongly recommend and urge all people in King County to voluntarily comply with this directive, and for all businesses that are open to the public, including grocery and other retail establishments, to continue implementing the policies and practices that you have had in place to ensure that your customers and employees wear face masks. This directive will remain in effect until Public Health Seattle and King County confirms that 70% or more of adults aged 16 years of older and older have been fully vaccinated against COVID-19 with currently authorized vaccines. I'm going to repeat that. This directive will remain in effect until Public Health Seattle and King County confirms that 70% or more of adults aged 16 years of age or older are fully vaccinated against COVID-19 with currently authorized vaccines. And as many of you know, Public Health Seattle and King County has previously established a goal for which we're on track for achieving of 70% COVID-19 vaccination coverage of adults 16 years and older by June 30th, 2021. And such coverage is expected to significantly reduce the risk of COVID transmission in the county. So to further clarify, let me just answer this question directly. Some may be wondering why they should wear a mask if they're vaccinated, especially since we agree that COVID-19 vaccines give a high, excuse me. Let me start that over. Some may wonder why they should wear a mask if they're vaccinated, especially since we agree that COVID-19 vaccines give high protection against infection and spreading the virus to others, and unvaccinated people are the ones at risk to acquire and spread COVID-19. It's because in stores and other indoor public spaces, if we say only vaccinated people need to wear a mask, we have no way to know who is vaccinated and who isn't. And it's impractical for businesses to determine that. If unvaccinated people do not wear masks in indoor public spaces, the risk for COVID-19 spread increases. So from a practical and community health perspective, the most reliable way to ensure everyone is safe is for everyone to wear a face mask in indoor public spaces for a few more weeks until we get vaccination rates higher and disease rates continue to drop. I want to take a minute now to emphasize that we should all celebrate the progress we've made as a community and as a nation to reduce the threat of COVID-19 and credit the tremendous impact of highly effective vaccines for much of our current and our anticipated long-term success. However, it's also critical to recognize that this pandemic is not over, and there's a real possibility that we may see increases in COVID-19 activity in the coming months, perhaps in the fall. And as long as COVID-19 is spreading anywhere, we remain at risk. So please, the most important thing you can do for yourself and for your community is to continue to get vaccinated. COVID-19 is still with us. And don't throw away your masks or forget the combination of strategies that are most effective against COVID-19. Now, it's inevitable that fewer people will be wearing masks in the future. And because COVID-19 is not going away for good, I also want to take this opportunity to stress that steps to improve ventilation and air quality are especially important now to reduce the risk in indoor settings. All businesses and workplaces should review the guidance on our website for improving indoor air quality. I anticipate that in the future, masks will continue to be recommended for unvaccinated people when COVID-19 is active. And even in the absence of mask mandates, some vaccinated people may choose to continue to wear a mask based on personal choice and their individual risk and risk tolerance. And it's very reasonable for vaccinated people with weakened immune systems and anyone who wants to reduce their risk to the greatest extent possible, even for mild infection, or because they may have a vulnerable person in their household, to continue to wear masks indoors when around unvaccinated people, especially when there's significant COVID-19 activity locally. Mask wearing by anyone should be expected, accepted, and respected. In closing, we're not asking people to do anything new, additional, or different, but to just keep doing what's been working well for us and continue to wear masks in indoor public spaces as we vaccinate more people, get COVID-19 rates as low as we can, and thereby lower the risk for everyone as much as possible before we lift the indoor mask requirements in the near future. Like much else of what we've done to be one of the most successful counties in the US during the COVID-19 pandemic, working together for both the individual and the common good continues to be the best way to protect us all. Please get vaccinated soon. I look forward to your questions.
Thank you very much, Dr. Duchin. And again, just a reminder for media, you can use the raise your hand function. We already have several questions coming in. And while Dr. Duchin gets a drink of water, I just also wanted to let folks know that we have posted on our blog, publichealthinsider.com, some more information and a Q&A with Dr. captures much of what he's shared with you all today. So that's called What You Need to Know About King County's Mask Directive for Indoor Spaces, and you can find that again on publichealthinsider.com. So let's start with questions. Evan Bush, you can go ahead.
Thanks so much, Dr. Duchin. I was interested in the second part of the directive, that a face covering is required, or not required, but encouraged, unless a state-approved method is used to assure that all people allowed inside a business have been fully vaccinated. Can you explain that? What does that mean? Does that mean that the workers would have to examine vaccine cards outside of business, or is that what you're referring to, or something similar?
Yes, thank you for that opportunity to clarify, Evan. The directive states that if there is a state-approved method to establish proof of vaccination and all persons inside can be shown to have been vaccinated according to that proof, indoor mask requirement is not necessary. So that would require the establishment to check reliably using that specific method of proof that the vaccination status of people that they're admitting. So the state currently approves the vaccination card that's issued by Washington State vaccination providers, which has the person's name, the type of vaccine provided, the date of the last dose administered, because we're talking here fully vaccinated 2 weeks after the last dose, or a photo of that document, or a documentation from a licensed healthcare provider's electronic record or the state immunization information system. Self-reported vaccination records that are not verified by a healthcare provider are not considered to be acceptable proof of vaccination status. And that guidance can be found, by the way, on the Washington State Department of Health website. It's called COVID-19 Spectator Event Guidance.
Great. Jessamine McIntyre, you can go ahead.
Thank you, Kate, and thank you, Dr. Duchin, for your time again. There's a June 30th reopening goal for the state, and it is said that it could even come sooner if certain goals are met. How concerned are you that everyone might just discard their masks at that point, especially considering the low efficacy rate among those who are immunocompromised, even though they might be vaccinated? And how long would you anticipate this new directive to last?
Thank you, Jessamine, for the opportunity to clarify. So we anticipate, and this is just coincidentally, we anticipate that we will reach 70% fully vaccinated for everyone 16 and older right around the time that the governor's planning to reopen Washington State. So it's very convenient. We may get there a little bit earlier, and maybe the state will get to the governor's criteria a little bit earlier, but they're going to be very, as far as we can tell, they're going to be very closely synchronized, which is great. I, of course, am concerned when I see people not taking advantage of an easy and low-cost way to protect themselves and others in the community. It's all about helping one another. The people who are unvaccinated are required to wear masks either way, through the state directive, the CDC directive, or a local directive. What we're doing here is saying, please let everyone continue to wear masks, because we know it's so hard to differentiate who and who's not vaccinated. Some people who are not vaccinated may find it stigmatizing to put a mask on if others aren't wearing masks because they're vaccinated, and that might be a disincentive. So I think no matter how we look at it, if we, at this point, say vaccinated don't have to wear masks and unvaccinated do, there's a strong likelihood that there'll be many people who won't feel comfortable complying with that, and we'll have people who are unvaccinated without masks mingling both together and with others who are susceptible. So by waiting a little bit, we give everybody some warning that this is coming. So those who may have been on the fence about getting vaccinated or just haven't been motivated now know that in a couple of weeks, most of our public spaces will include people who have not been vaccinated and who are unmasked. So that gives you a chance to get protected. And it also gives us a chance to hopefully see our disease and hospitalization rates return, or not even return, but get down to a much safer level. We are still at levels of COVID-19 transmission that are considered high or substantial by the CDC. And we would love to see those levels as close as possible to the low level of transmission. That will mean that you're less likely to bump into someone who has COVID-19. Right now, you have significant likelihood of bumping into someone with COVID-19 based on the transmission rates in our community. But the more we can suppress transmission, both by wearing masks and by getting vaccinated, the less COVID-19 will be out there when we finally remove our mask mandate, and that will be safer for everyone.
Thank you. Let's take a question from Meher Gruwal. You can go ahead.
Hi, Dr. Duchin. I'm Meher Graywall from Worth a Shot, and my question is, so with the end of the school year coming up, many kids will be attending middle school or high school graduations, prom, or summer camps. What are your thoughts on how kids can participate in these activities safely, and would you recommend masking for kids who are fully vaccinated?
Thank you, Meher. I've got several recommendations. Number one is get vaccinated. Number two is get vaccinated. Number three is get vaccinated. Number four is, to the extent that you can, make sure that people around you are vaccinated, your other campers, your friends, your family. I do not believe that most people need to be wearing masks outdoors unless they will be in prolonged close contact and they're unvaccinated.
Great.
Thank you, Dr. Duchin.
Let's take a question from Eilish O'Neill. You can go ahead.
I was wondering if you're seeing significant amounts of indoor unmasking, or if this is more precautionary. You're trying to head things off at the pass before there are significant amounts of indoor unmasking in King County.
Thank you. Before the CDC director's unexpected announcement, we had no worries about indoor masking. I issued a directive a year ago, a little over a year ago, with the current guidance, the current requirements for everyone to wear indoor masking, and for businesses to comply with indoor masking and to ensure that their customers were masked. And it was working so well for us. And people were not complaining, and the data that we had from our colleagues at the University of Washington suggested that mask compliance was very high in our area. So it seemed to be working really well. Now, when the CDC director came out with her sudden and unexpected announcement, many people just decided they didn't want to wear masks anymore. And I'm sorry for that. I mean, I've heard from a significant number of people that they want to take their masks off, that they feel like they're protected, that they are not going to get sick, that they are not going to spread it. And if there are unvaccinated people out there and they get sick, that's just too bad. And if they spread it, that's just too bad. But I want to exercise my personal freedom not to wear a mask. And I understand that. And the day is not far off when we will agree that everyone will have that personal choice. And that will not be problematic from the population health perspective. However, currently, we're asking you to do us a favor. Even if you're vaccinated, do your fellow residents, your friends, your family members, people who have weakened immune systems, young children who can't be vaccinated, and anyone who's not vaccinated, do us all a favor and just continue to wear the mask for a while longer as they get a chance to be vaccinated, as our disease rates come down, and as the risk lowers for everyone. Some people, many people, do not feel the mask is a major imposition and are happy to continue to wear it both because it may provide a little bit more safety for themselves, but also because they know it provides significant safety for others. And by having everyone wear masks, I think we can be all much more confident that unvaccinated people are masked. And when we don't have that assurance, the risk just goes up. And my job is not to go with the flow, not to take the easy path of least resistance necessarily, but to do what's best for our community. And because I knew that our community was doing perfectly well with mask wearing, that this was not a problematic intervention that was costly or disruptive, that we could do this for a couple more weeks and get significant gain to individual and population health for all.
I ask a quick follow-up?
Yes, go ahead.
So I guess why I ask is because anecdotally, my colleagues and I are seeing that in indoor public places, the kinds that the directive would apply to, like grocery stores, for example, people are continuing to mask and all the signage is still up. And just people aren't taking off their masks much. But I was wondering if you're seeing something different from that, if there are parts of King County or kinds of businesses where you are seeing significant movement towards unmasking in indoor public places like that.
Well, we don't have comprehensive data on, every store, retail establishment, sports club and so on, and what's happening there. We just have anecdotal evidence as you refer to. I've heard from many that people are continuing to mask, that they've been out and about and everybody has their masks on, and that the employees in the stores have their masks on. I've heard from others that they were quite surprised to hear several local businesses immediately remove their masks required signs and that their employees unmasked. So it's been a mix, but I would say in general, what I'm hearing is that people are happy to continue to wear masks to protect themselves and their community members for a few more weeks in order to lower the risk for all of us, and that most people are continuing to wear masks indoors. I can't provide a precise, estimate, and I haven't heard any particular complaints.
Great, thanks for the question, Eilish. And just a reminder to also share your news outlet as you ask your question. Let's take another question. John Carlson, you can go ahead. Let's give John another moment just to see if he can unmute.
There we go. I'm very sorry. John Carlson with KVI Radio. Thank you very much, Dr. Duchin. Let's start with the people who are most at risk from COVID, which would be older people, particularly those with pre-existing health conditions. What percentage of people above the age of 60 in King County have been vaccinated?
Very high. If you have a minute, I will try and pull that up for you. Let's see. I think we probably use the 65 cutoff, if that's okay for you.
Sure.
So let's see. Just scrolling through a very long report. I'm having a little trouble bringing it up, but I will get it.
Just a ballpark figure from what you recall would be fine.
I prefer to give you an accurate assessment. I'll tell you what, let me go out to our online dashboard and see if I can pull it up that way, because it's not loading for me here.
Thank you.
And while Dr.
By the way,
while Dr. Duchin is pulling that up, John, is there another part to your question that you wanted to ask?
My guess is that a large proportion of the people we need to be most concerned about are already vaccinated and hence already protected.
Absolutely.
And if that is the case, those of us who have made the choice to get vaccinated to protect ourselves and protect the people around us, both family and strangers we happen to come into contact with, seem to not be a problem when it comes to mask wearing. So I'm wondering, since the people we're most concerned about are protected, since everyone who wants to be vaccinated has had that opportunity now for quite some time, there are no lines in any of the places to get a vaccine anymore. In fact, many states are sending back part of the vaccine stocks they've been sent. Then why should those of us who made the responsible decision to be vaccinated continue to wear masks because someone else chose not to make that choice? There's nothing that I can do to make them feel, I don't have to worry about them giving me COVID. They don't have to worry about me giving them COVID. So isn't wearing a mask basically, when you've been vaccinated, what critics are saying? Isn't it theater?
Yeah, I'm sorry, John. I went through a very long rationale which addressed each and every one of your points. Maybe you joined the call late, but I'll just summarize by saying that you are absolutely correct. We have a very high 90% or so of our 65 and older who are at the highest risk of death from COVID covered. Yet there are still a person hospitalized every 13 hours in King County currently. And the number of cases that we're seeing are still higher than they were before this fourth wave began, higher than they were during the summer wave last year. So there's lots of disease out there, lots of severe illness, not deaths, because those are the most older adults are protected currently, but a significant amount of severe illness, significant amount of long COVID developing, and others who just, have not necessarily had the opportunity to be vaccinated. You assume everyone's had the opportunity to be vaccinated, but I don't think that's accurate. Some have and have chosen not to and will not. And those, if we knew that everybody that's not vaccinated now will never be vaccinated, your point would be fine. I would still like to wait until to see disease rates go down lower, because the more disease we have in the community at any point, the more susceptible we are to future surges. But in any case, there are many people who have only recently been offered the opportunity to be vaccinated. 12 to 15-year-olds just a couple of weeks, younger adults, everybody 16 and up just about a month in April. And there are communities that have significant challenges accessing vaccine. Not everybody is able to drive to one of the mass vac sites. So we are continuing to see people be vaccinated every day. And that's a perfect testament to the fact that people are still interested in getting vaccinated. And the more of them get vaccinated, the lower the risk will be for everyone. Now, you, obviously a healthy man, feel very comfortable going about without a mask. And I would think most people who are vaccinated should feel that way as well. However, as I mentioned, there are tens of thousands of people in our county who have underlying immunocompromise, and there are people who are in contact with high-risk others, and there are people who don't, knowing that the vaccine's great but not 100% protective, also just want to reduce their own risk as much as possible. So what we're asking really is that those like yourself who are healthy, vaccinated, made the right choice. Thank you for doing that, by the way. You've made a great choice for your personal health, and you're protecting those around you and in your community, and I very much appreciate that. We're asking those of you who've made that great decision to bear with us just a little bit longer for the sake of people who are not yet vaccinated, but who would like to be vaccinated, who can be vaccinated, and to help protect them for the next month or so while that happens and while our disease rates continue to drop. As I mentioned, we still have high levels of transmission in some parts of the county. I mentioned that our Black and Hispanic community members are only vaccinated at relatively low rates in the 30% complete rate range, and there's much room for improvement. So by working together and getting everyone's cooperation, it's really a helping altruistic act to help everyone else in the community achieve the level of health perhaps that you have, or continue to be as healthy as you are without risking, COVID-19 infection in the workplace, or if someone's a worker and has to be exposed to lots of people who decide to come in unmasked, yet are unvaccinated. So it's really just a safeguard against that situation where if we had no way to know who's vaccinated and who's not, many people would be exposed to unvaccinated people who are not wearing masks. So it just helps us achieve that goal of protecting everyone while more people become vaccinated and disease rates further drop. And when disease rates further drop, the risk to everyone is also reduced.
Thank you very much. And I think we'll have time for one or two follow-ups, but before we do that, I just wanted to share one question from Facebook in the community. Community member asking, how do you explain the continued high rate of COVID-19 in King County, given our relatively high overall vaccination rate? What's the sense on the epidemiology around that right now?
Mm-hmm. Well, almost everyone that's getting COVID-19 is not vaccinated. It's not hard to understand. We talked about herd immunity with respect to COVID-19, and we have more transmissible viruses now than we did when this outbreak first started, and the best guesses are that you need 80+ maybe % of the population vaccinated to have herd immunity. We're not going to get there. COVID-19 will continue to circulate. And what that means is sooner or later, most people are going to get infected if you don't get vaccinated. And so we have, as I mentioned, we have a pretty high vaccination rate, but we're looking at 50% or so completed. And of those, as we heard just a few minutes ago from Mr. Carlson, the vast majority of those are the older adults who are at highest risk. So there are many younger people who are not yet vaccinated, and that leads to high disease rates. Many of those people are being hospitalized. We're seeing higher proportion of our hospitalizations among younger adults, and some of them are developing the chronic complications of COVID that can go on for months. And so, there will be an equilibrium we're going to come into with this virus, where it will continue to spread in our community. It may be a seasonal virus where we have, outbreaks like we do of other respiratory viruses in the wintertime. But we want to minimize the damage this virus can do by getting as many people vaccinated, and that would mean younger people as well as older people, minimizing the disruption it will do in workplaces and schools and other environments, even if it's not killing the oldest in our communities. And also understand that the lower we can suppress the level of transmission, the less likely anybody will be to come in contact with someone with COVID. So if they are vulnerable, susceptible, or just one of those people who is unlucky and doesn't respond to vaccine, you'll have a much lower chance of getting sick.
Thank you very much. And just so folks have it, you can go to kingcounty.gov/vaccine, and that's the information for our high volume sites, as well as several pop-up sites that are operating across the county, including opportunities for walk-up sites. Let's take a question from Lisa Bauman. You can go ahead.
Hi, Dr. Duchin. This is Lisa Bauman with the AP. Oh, wait.
Yes, you're unmuted. You can go ahead.
Can you talk, and maybe I missed this, a little bit about why you're going with a fully vaccinated mark versus the state, and I know Oregon too, going with the measurement of 1 dose?
Thanks for your question. There's a couple of reasons why you might see differing metrics. One is nobody knows what the right measure is, the right level of vaccination in the community to effectively suppress transmission. And we are striving for excellence here. We have always had, as part of our COVID vaccine strategic plan, that target threshold was, from the beginning, 70% of the population, 2 doses completed by the end of June, because we felt that was a reasonably high enough threshold to ensure us that we'd make a significant dent in COVID-19 transmission, but not something that was unrealistic and out of reach. And, one of the issues with 2 doses is, as I mentioned, we currently have 70% with 1 dose, but that statistic hides a lot of disparities and inequities underlying in the population, because most of those people who are covered with 2 doses are the older adults. Most of the people are covered with 1 dose are the older adults. And so we'd like to see more equitable coverage throughout the age range so that everyone can remain healthy and free from COVID. The other reason is that we knew that one of the things that we really think is important here is, the surprise announcement by CDC caught a lot of us off guard. I would say caught all of us off guard, even the president, as you know. So we think people deserve time to understand what's coming and to plan. That we're going to transition to no mask mandates very shortly, and allow people to take that information and use it to motivate themselves to get vaccinated, or to think about how they're going to protect themselves in the world where people will not be wearing masks and may not be vaccinated. That I think that's really important too, because there's not an on-off switch. It's not as though we or anybody else in this country has reached a magical level of either COVID incidence or vaccination coverage where the risk is just dropped dramatically and all of a sudden we don't need masks anymore. This is a continuum of gradually decreasing risk, and there's no absolute right answer to at what point do you make the trade-off between community protection, the need for community mandates, and disease incidence. But we've done really well here in King County with respect to overall number of people infected, with respect to overall deaths compared to the rest of the country. And I'd like us to continue that record of excellence and bring it home now without an undue onerous new requirements, just continuing to do what we're doing and what's working so well for a couple more weeks, and let us do the best we can before the inevitable time comes when the governor opens the state and people will get back to their old lives. We don't know what's going to happen at that point. We don't know how this virus, thinks. It has a lot of mystery, and it retains a lot of mystery, and we need to retain a lot of humility when we try and predict the future. But one thing I can tell you is certain is that the more people that are vaccinated and the lower the disease rates are, the healthier we will all be. And so I would like to do whatever we can without a lot of cost, without a lot of disruption, without a lot of inconvenience, to put us in as best a position as possible at the time that the governor reopens the state and people start to gather again and do things that we haven't seen in a long time, because the virus is going to do things that we may not be anticipating.
Hi, Dr. Duchin. This is Abdi with the Somali Bridge. We're a media outlet that is serving the Somali community in King County. And your message, you really answered a lot of questions regarding COVID. And your message is really important to our community because we're very underserved when it comes to vaccinations. I know Somali Health Board and others are doing great, but we'll gladly relay your message. Our community often do not have access to information from mainstream. So we appreciate it, and we would like to pass that message to our community. So thank you.
Thank you, Abdi. And I really appreciate what you're doing to help bring this information to your community that has not been able to get vaccinated to the same extent that many others have. And whatever we can do to help you and others who may be listening, who are aware of people who have not been able to get vaccinated, but who are interested in getting vaccinated, we are interested in doing whatever we can to bring vaccine to you or to help facilitate access for those folks who still want to be vaccinated and will be vaccinated over the coming weeks. That will be our focus. So thank you for joining us, and thank you for what you're doing.
Yep, you're welcome.
Thank you so much. Tammy Mutasa, did you have a question?
Yeah, sure. Thank you for your time, Dr. Duchin. I was just wondering, I know you mentioned this, that this is a voluntary urging, but is King County going to be, I guess, enforcing this directive or checking? Because we know the people who, are going to do the right thing and have done the right thing or had the opportunity to keep masking up and gotten their vaccines have done that. And the people who won't do that just aren't going to do that. So I guess your message for that.
Yeah, thank you. So as I said, the directive that I'm issuing today is basically superseding the previous directive that we had in place around mask use. It's the same level of enforcement. It's the same request for voluntary compliance. Nothing's changed other than it's being continued and modified beyond what would have been if we had done nothing in the CDC guidance and the state guidance had superseded. So we did very well with the past directive. We did not have to do any enforcing. Our business community was outstanding. Retail, restaurants, groceries, they know what to do. And I don't have any reason to think we would need a higher level of enforcement for them to continue to do the same thing that they've been doing. The public has been great. The public has had a high level of compliance with masking based on the initial directive. And I don't see any reason why that would change with the new directive. But the bottom line is we're not going to be policing. We're not going to be taking people to court over this. We're depending on people to voluntarily comply. And of course, if there's a business that's not complying, people have a choice to go there or not. If folks see that there's a lot of unmasked people in a grocery store or another retail location, or the employees aren't masking and they're not comfortable, there'll be plenty of other places that will be safe for them, I'm sure, in King County. So maybe there will be places for only people not wearing masks. I don't know, but I certainly would hope that most of the community will continue to do the great job that they've done under the previous directive, under the new one. It's not for much longer. And it really is an important thing for all of us to squash this virus to the greatest extent we can right now, because it will be up to mischief as we get back to our old ways, and it will be a real challenge, I think, in the fall when it's going to be, at the moment, it's hard for us to predict. That the safest, most secure thing we can do is to get vaccinated to protect us from any new surprises that the virus may have in store.
Thank you very much. And thank you to media for all the important questions. Did you have any final words, Dr. Duchin?
Yes, first of all, just thank you again. I think, I understand people have questions about this. People are frustrated. The communication's been confusing. People are tired of wearing masks. Some are never letting them go. It's a spectrum. But I do want to give a special shout out to those who are continuing to wear their masks, even those who are not happy about it. Thank you. You're helping all of us stay healthy and contributing to community success against COVID-19. And again, just want to emphasize that we've been very successful in King County. We've worked together both for the individual and the common good. That's the best way to protect us all. Please get vaccinated soon, and I look forward to talking to you again before too long.